Hello, my name is James Black, and I'm the Chief of Vascular Surgery and Endovascular Therapy here at Johns Hopkins Hospital in Baltimore. I'm also a member of the Society for Vascular Surgery, and today we're going to discuss abdominal aortic aneurysms. The aorta is the main blood vessel in our body, carrying blood from the heart to all of our vital organs. An aneurysm of the aorta is an abnormal enlargement of the aorta that carries a risk for rupture, hemorrhage, and death. Every year, in the United States, approximately 200,000 people are diagnosed with an abdominal aortic aneurysm. Unfortunately, abdominal aortic aneurysms remain a leading cause of death in the country, and the 10th leading cause of death in men who are older than 55 years of age. While aneurysms are more common in men, they still occur in 6% of women above 65 years of age. Because the mortality associated with a ruptured aortic aneurysm is so dramatically higher than elective surgery, the emphasis must be put on early detection and repair prior to the occurrence of rupture. Overall, dying from an abdominal aortic aneurysm can be prevented with early detection and appropriate timely treatment. The Society for Vascular Surgery recently provided comprehensive guidelines to help decision-making for patients with abdominal aortic aneurysms. Screening for abdominal aortic aneurysms has been shown to improve the risk for mortality in specific patient groups. Most importantly, the screening for these abdominal aortic aneurysms can be performed safely without any risk to the patient using ultrasound. Currently, we recommend one-time screening of all patients greater than 65 years of age, as well as those with a history of tobacco use. Additionally, patients who have first-degree relatives with an abdominal aortic aneurysm may also benefit from screening for an abdominal aortic aneurysm. When an abdominal aortic aneurysm begins to approach the threshold for surgery, most patients are referred to a vascular surgeon to address the aneurysm through surgery. Your doctor will discuss the risk of the aneurysm with you, and the surgery is generally considered for aneurysms with an abnormal shape, what we call a saccular aneurysm. Surgery is also appropriate if the size of the aneurysm is greater than 5 centimeters for women and greater than 5.5 centimeter diameter for men. Additionally, pain in the back or pain in the abdomen can also prompt surgical repair. So why consider a vascular surgeon for the ultimate repair of your aortic aneurysm? Well, vascular surgery is the only discipline among many in the United States with specific training to study the natural history of abdominal aortic aneurysms, the medical treatments that can hold off surgical intervention, as well as the minimally invasive options to treat the aneurysm like endovascular surgery, as well as having the experience with more traditional open surgical repair for patients. A vascular surgeon can partner with your other physicians to provide the most comprehensive treatment of the aneurysm and other conditions of the vascular territories. So what to expect when you see your vascular surgeon? A vascular surgeon may recommend your aneurysm continue under surveillance if it's not yet at the diameter that requires surgery. For aneurysms that have a diameter between 3 and 3.9 centimeters, every 3 years for ultrasound is a reasonable approach. When aneurysms grow to reach between 4 and 4.9 centimeters in diameter size, annual screening of the aneurysm is certainly appropriate. And when the aneurysm is getting closer to surgical threshold, above 5 centimeters in size, checking the aneurysm every 6 months until it reaches 5.5 centimeters is a standard recommendation. I encourage you to seek out a vascular surgeon to manage your abdominal aortic aneurysm. Ask questions of a vascular surgeon. They're your best resource to help allay your concerns and fears regarding the ongoing surveillance of the aneurysm, as well as your concerns for the risk of surgery. If you would like additional information, check out the Society for Vascular Surgery website patient information page, which has an excellent summary of information about abdominal aortic aneurysms to help understand our current treatments. For more information on this and other vascular health conditions, visit vascular.org. Seek care only from certified vascular specialists, the only doctor certified in comprehensive vascular care.